With a quick Google search, you can find hundreds of mock interview questions, especially for your nursing interview. But the real test, practicing out loud, under pressure, without sounding too robotic or rehearsed.
Exactly. Today we are walking through some of the most common interview questions that new nurses get asked and showing you how to practice them so your answers sound confident, natural, and unforgettable.
This is the Nursing Navigator.
Nursing Navigator's here. Wipe away those study tears. Hurst Review's got your back. Listen close, stay on track.
We know that you are exammed out. So let's think of interviews less like an exam, less of question and answer, and more like an audition. Doesn't that sound fun? Because employers aren't just listening for the textbook answers. They're looking for the 3 T's: teachability, teamwork, and trust.
Strong answers aren't memorized. They're practiced out loud. So today we'll anchor all of your practice using the S.T.A.R framework. So that way you can organize your stories in a clear and confident manner.
That's right. I love how we're talking about memorization and talking through it and walking through it, because what does that sound like?
It sounds like the Aunt Marlene method to Hurst Review.
It really does, because you can't sit there and memorize everything.
Yeah.
And you don't know what questions they, in an interview, are going to ask. You don't know what questions the NCSBN is going to ask on the NCLEX.
Yeah.
But all we're doing is using that critical thinking out loud, writing stuff down, practicing, and bringing in a friend to help you prepare, not for the NCLEX, Hurst will help with that, but prepare you for your interview.
Yep.
What is the S.T.A.R method?
Okay, so the S.T.A.R method is situation or story, task, action, and result.
I love an acronym. Well, it also works too, because we want you to go in and be that shining star in your interview. And we put little stars on notes that are really important. So this is one that you are going to want to star, is the S.T.A.R method.
Right.
So really all this is a structure or a reference point to go back to help your answers be clear, concise, and consistent. A great interviewing tip, this applies to nursing interviews or just interviews in general, is to have that story or situation in mind. And depending on what question is asked, you already have kind of some preloaded answers. Yeah. And quickly you're going to have to think, okay, which of these answers that I feel really confident in, which story is going to address this question that is being asked the best? Yeah. I don't know how well this is going to be taken, but you don't necessarily have to answer the question that is being presented to you. Hot take. It's about that confidence and that body awareness. Obviously, you don't want to be asked what's your favorite color, and then you go and you talk about how you love chicken nuggets for dinner.
Yeah.
There's no, that's a very silly example, but there's no correlation there. But if you can kind of take the situation and tie it back to the question that's being asked, that's a really good strategy. So can you walk us through maybe an example of this S.T.A.R method for our listeners?
Sure. So we start off with our story or situation. And so if the interviewer asks you, tell me about, that's a perfect question that they love to do. Tell me about a situation or a time when blank, blank, blank. Okay, so with our situation or our story, we could start off by saying, once I had a patient who was really anxious about their medications. Okay, so that's setting up the situation and starting off the story.
Setting the scene.
Setting the scene. And then our T is task. So what did you do? And so what I needed to do is I needed to reassure them about the process and the medications that they were taking. All right, and so for the action is I slowed down, I explained everything step by step, and I asked them open-ended questions. All right, and then R is result. So all of those things I did, what happened as a result of that? And so the client calmed down, They took their medication, and then they even thanked me for listening.
That sounds like a pretty simple framework
Yeah.
to follow. And really, I think you can answer pretty much any question using that
Yep,
method.
you can.
Maybe one thing to preface with the STAR method, it's not the end all be all solution. But if you're just looking for tips, maybe you haven't had a formal interview yet, this is a really good starting point. With any good story, there's a simple arc, a past. So your past could be referencing your education, your clinical experience. There's the present. So that's your skill sets that you're bringing into the table. And then the future. So in an interview setting, the future is how you are fit for this role.
Right.
So that's just another way kind of to think about it. But I think one thing that's really important that we're going to emphasize a lot during this episode is to practice out loud and not just in your head.
Yep.
It's the same methodology of writing down your notes, practicing it out loud to where you can hear it. If you have an audience, maybe a friend or a family member that can facilitate a mock interview with you and give you some feedback. 'Cause you'd be surprised. We make a lot of cuts on this episode. The ums, the uhs, the stuttering, the not finishing your sentences. It can be difficult. It's natural, of course, but we want to prepare you to walk in with confidence. And a lot of that starts with practicing out loud.
Yeah.
So let's start there. You go online and you look this up. You're silently reading these questions in your head. So once you read them, you're probably silently practicing in your head how you would respond.
Did you know that silent reading tricks your brain into thinking that you're prepared?
Because I can skim through something and I'm like, oh, I read that. I know what it is.
Mm-hmm. And then if somebody asked you and said, tell me what you just read, or tell me what, you comprehended from that, you are fishing. Like you're like, you're not ready. Yeah. And so that's funny. That's why we say talk about it out loud, say it out loud, have that audience and be able to talk about it. And so when you are speaking out loud, there's certain things that you're checking, right?
What are we checking?
You're checking your pace. Are you rambling? Are you just giving really quick, short, yes, no answers? Are you not giving any details, leaving out details, not finishing a thought? Not fully answering the question to its appropriateness.
Yeah. And what signals is that sending to the person listening or the person interviewing you? Because we know that they're picking up on all these signals, verbal, nonverbal, everything else.
Right. Well, in the world of nursing, what I think that automatically triggers is you have to remember that a part of your job is patient education. Mm-hmm. And you're not just doing. I think we think about that like in nursing, like the skills and what are my hands doing. When you have to educate the client, you have to speak to them. And so are you able to finish the thought out? Are you able to give clear and concise instructions? Are you able to ask clarifying questions? Are you gathering information from them and picking up on when they don't get it? And are you able to reinforce teaching well? And so if you're not able to do that during an interview process by, sharing your thoughts and clearly doing that, then you're not going to be able to do that with the patient either.
That's good.
Yeah.
And if it's too short, then maybe you're not giving all the information that's needed.
Right.
If it's too long and you're rambling, then you may come across as like underprepared.
Right.
All right. So we have the foundation laid. Our listeners are wondering, well, what types of questions? Like, tell me what questions they're going to ask me. Ashley feels confident that there's certain categories that you can expect to have some questions being asked on, and then we'll get into some examples of how those questions could be presented. So let's start with the categories. What are these question categories?
All right, so your first one is general fit and motivation. Then you have clinical and patient care scenarios, teamwork and communication, stress and adaptability.
Oh, that's a hard one to answer.
It is. Mm-hmm. And then, of course, professionalism and growth.
So let's start with the first category. We have our general fit and motivation. Pretty much any interview is going to start out with the Tell me about yourself.
Yeah.
Is this where that question falls into?
It absolutely does. Okay, and I think what we have to remember is they're not just asking that question just to ask. And it's not really even just an icebreaker. It actually serves a purpose, is that they're trying to gather from not only what you say during that time, but how you say it, if you're going to be a good fit for their team.
So what do you tell about yourself? Do you go into the personal aspect? Do you strictly keep it professional with your experience? Is it a hybrid situation of that? How long do you talk for?
Right. I think this is kind of where you do your homework a little bit on the front end, is think about where you're interviewing. Like, what position am I interviewing for? What area is it for? How many people are in this room when I walk in? Kind of read like the area. If you are walking into a recruiter's office, right, and they have pictures of their family around, that's a really good place.
That's good.
Because you're trying to make a connection,
Yeah.
right? You're trying to make a connection with the people that are interviewing you.
Because you have to do that with your patients and
Right.
your clients as well.
Right. And so if it's a boardroom, like you're in a room full of people, like it's a interview with more than one person, and there's no personal connection you can easily make there, then I would keep the things about myself personally very short, very to the point, and then maybe get into sharing things about yourself that automatically would show you that you're a team player. Anything about you that shows good fit, okay, strengths. So before they ever have to ask that question about strengths, you're sharing that.
How would you feel comfortable going back to Ashley in her first job interview and giving an example?
Oh, cue the trauma. Yeah,
Yeah.
for sure.
Okay. How would you answer that question? Obviously, your resume is a lot longer now because you've had that nursing experience. But if you could go back to your first job interview, and I said, "Okay, Ashley, welcome. Tell me a little bit about yourself."
At the time, I would probably just look at them and quickly say, I am a current graduate of the University of Southern Mississippi, from a small town, grew up in a small town called Monticello. I'm very family oriented, so I have a big family and I love being able to do things with them. But because I'm very family oriented, I love being able to not only work with patients, but work with their families too. And so I really am excited to be able to not only care for the clients at your facility, but I'm also excited to be able to care for the families in your facility too, because we know that it takes an entire team to be able to provide the kind of care that we need to.
That's great. I love how you tied in your past.
Yeah.
I went to the University of Southern Mississippi, and you're from a small town. That's where you were born and raised. So that kind of checks that past box. Present, I'm a new nurse. I'm excited for this opportunity. Future is working with patients and their families and working with the team at the hospital that you're interviewing with. I also thought that was a good length. I don't know your whole life story.
Right.
You weren't just very short with it either. So around that 90-second mark, I think felt good. What do you guys think as the listener? Drop a comment or a review on the podcast episode and let us know. How often is it in an interview setting where you are asked, okay, why did you choose nursing?
Oh, gosh. You're asked this question in your other initial interview when you didn't realize you were being interviewed. That first day of nursing school, when your teachers ask you.
They go around the
room. They go around the room. Why did you want to be a nurse? That's an interview too. They are gauging already, like, this student's strong. This student needs more support. This student, I don't even know if they want to be here. This, like, they're gauging that from body language and the response to that question. And so what I would recommend on this question is to use that story, use that STAR method if you need to, but go beyond the I just want to help people answer. because there are a million ways to help people that don't involve nursing. You can help people in all kinds of ways. Specifically, why are you choosing nursing? And a story is a really good way to connect and to make that emotional connection with other people in the room. Because once you share your story, they start thinking about theirs. And so, you're building a bond and a quick, rapport with the people that are interviewing. And sometimes that makes that interview feel more like a conversation than an interrogation.
And the good thing about the STAR method with this one is we already know the result.
Right.
The result is you went to nursing school and graduated nursing school and will be a nurse as your profession. So that even takes out the result side of it, but it's that connection piece because every nurse has their own reasoning, as you said, to make that conversation a little bit easier.
Yep.
So that's a good one to anchor the STAR method in.
Yep.
And like we said, all you have to focus on is your situation, your task, and your action. And even action is already filled out too, unless you have something really personal that you want to share.
Right.
This is a great way to be vulnerable. As a nurse, you ask out of your patients to be vulnerable with you. And it's important to reciprocate that at a professional level. But it's a way that you can really connect with those people that you are interviewing with. And it's really easy to tie your values back to patient care.
Right.
Speaking of patient care, your clinical and patient care scenarios is your second category that you can expect. What is a good standard question that falls under this category?
This is the storytelling aspect. And they go, tell me about a time. And so maybe they say, tell me about a time that you provided compassionate care. And if you don't already have that story prepped, if you have not already spent time thinking about this, when they ask you that, you are caught off guard and you're like, let me think, right? And you don't want to have to sit there and either one of two things. You do not want to have to sit there and think for a very long time. And you do not want to lie and just make up a story because you can't think of anything. And so this is where that prep work comes into place. Think about this beforehand and then tell the story.
Yeah, and what cues are you sending to the people on the other side of the table? It's, if I can't think of an answer, they're questioning your experience.
Yeah.
And you may be saying to yourself, I don't have experience as a nurse. I'm applying to be a nurse, and it takes experience to have experience. But that's not true. Your clinicals is a great experience that you have under your belt. Maybe you have experience from a previous healthcare environment too, but we are telling the truth here. So bring it back to a clinical experience that you had during nursing school.
That's right. Or even a classroom experience, because the things that you did with your classmates is also an ability to show compassionate care. What kind of classmate were you? Because if you couldn't show compassionate care to your fellow classmates, then you'll do the same thing to your patients.
And not only how it's impacting your patients, but how is it impacting your coworkers and your future coworkers? Because that's who your classmates are.
Right.
And how are you going to be able to work on a team? For retrievers, when it comes to answering this question, what's one thing that they should be a little bit cautious of, or what is one thing that they should practice beforehand?
Right. With our golden retrievers, they love to help. They love to help. I'm here. I want to help. So don't gush on that, because they know that. They know that, you want to help. So maybe focus a little bit more on teamwork and collaboration. Like, how were you able to show yourself as a good teammate? Or how were you able to show yourself as a good collaborator? What role were you able to play?
What about our bold beginners?
Don't make it all about you. Like our bold beginners, it's like, I know this. I already know that. Don't make yourself the hero of the story. Okay, like, again, that collaboration piece is going to be important for them too. So show how you were able to be an excellent teammate.
And the wallflowers?
Wallflowers don't always like to be the center of attention. And so when they ask you this question, speak clearly, slow down, and answer thoroughly. And it's okay. It's really okay to answer this question with you in mind and say how you did this, because that helps you to shine through a little bit and not just, fade into the background.
So they might start with, they tell me about a time when for a positive experience. Then it usually goes into, okay, well, tell me about a time when something went wrong.
Right.
You made a mistake. It didn't go as expected. So what they're doing here is they're asking questions to see how you handle maybe a stressful environment, how you take ownership and accountability. So again, let's follow the same kind of framework when it comes to golden retrievers, wallflowers, bull beginners.
Right. And so first, mistakes are going to happen. And I think sometimes we go into this going, I can't make a mistake, because there's been a lot of things in nursing school where you just can't. You can't make a mistake. Mistakes are going to happen. And they're trying to gauge on, how are you going to respond to your mistakes? And so for the golden retriever, don't try to spin it in a way where you were like, I was just trying to help and this mistake was made. You need to own it. Okay, just stand in it, own it, and say, I messed up, and this is what I did to fix it. For our bold beginner, that bit of humility and being humble is going to help here. Admit it. Say what you didn't know. And that's okay, because we all don't know something.
Mm-hmm.
We don't know everything, and it's okay to say, I did not know this, and because I did not know this is what happened, but then this is what I did about it. And for the wallflower, this may sound horrible because I think this word gets, misconstrued, and they think it's negative, but it's not. Assertive.
Mm-hmm.
Okay, assertive is positive communication. In fact, it's probably the only way to communicate in a positive way. And that does not mean aggressive.
Right.
Okay, it means sure, right? And so for our wallflowers, practice answering those questions that they ask you with an assertive tone and a confident tone. So that just helps you be more sure of what you're saying, and it helps to build trust in what you're saying. So that way your employers, they feel confident about you.
Mm-hmm. I love how you're spinning this back.
Yep.
Because yes, we can talk about mistakes. Everybody makes them. Everybody deals with them differently, but don't leave it on the negative note on, okay, this is the mistake that happened.
Yep.
Even if they didn't ask what was a mistake that you made at clinicals and how did you fix it, they may not ask the second part of that question. You're answering it.
Yep.
Regardless if they ask it or not, this was the situation. This is the mistake that was made.
Yep.
And then here's the actions that I took proactively to make sure that it doesn't happen again.
That's right.
Leave your answer, your response to that question with a positive result to reassure them, okay, this person, they learn.
Right.
And they're willing to grow, and they're also willing to admit when they're wrong, but not only admit when they're wrong, but go make sure that they're doing it right in the future.
Right.
Another word that kind of scares people.
Yeah.
Constructive criticism. Some people are like, oh, I love constructive criticism. And then whenever you give it, they get super defensive or, they kind of shut down. But what this is leading into is category 3. And that's going to be your teamwork and communication. A very common question that you can expect to be asked is, how do you handle feedback? They're not saying positive feedback. They're not saying negative feedback. They may say positive feedback. They may say negative feedback. If they don't specify and say positive or negative, is it best to keep it more positive, more negative, neutral? If they leave it kind of open-ended, how should a student proceed with answering?
I would take it both ways. And the reason why is because with feedback, it equals growth, right? And so they may want to know how you handle people praising you. Like, do you let that go to your head? Or if you have received some of that, negative feedback, how do you take what they have shared with you and use it to get better? So I would probably spin this both ways, is that, the feedback that I've received before has been both positive and negative feedback. And so with the positive feedback, I, take what they've said. I know that this is something that I've done well. It's something that I do consistently well, but I don't let that go to my head. Like, I think that's a perfect answer to say, I am not going to get cocky about the things that I do well. And then when somebody shares something that I need to work on, I view that as, how can I grow? How can I get better? And so give an example, something that you were told that you might need to work on. Well, then how did you work on it? And then when you worked on it, what action did you get? Like, what result did you get from that? And so I would take it both ways.
Quick feedback point for our retrievers.
Yep. Don't over-explain. Just one and done. One example's enough.
Bold beginner.
Practice saying this out loud. I really appreciated that feedback. I appreciated it.
Whether you did or not.
Right. This might be okay time to lie.
And then for our wallflowers.
Confident thank yous. Okay. Confidently say thank you with eye contact.
I would hope that this is being asked in an interview setting. What happens when you witness something being done unsafe? Because they want to make sure that safety is top of mind and you are not going to participate or encourage or enable unsafe behavior. So maybe an example question of this could be, what would you do if you saw a coworker doing something unsafe?
Oh, the best answer here is, do not take this personally. Like, don't let this go any further than protocol. I would answer with that, is that if I viewed someone doing something unsafe, the first thing I'm going to do is follow this facility's protocol for that. And so some examples of following a protocol is that, the patient is the first thing in our mind, and that's who we're there for. So I'm going to protect my patient first. I'm going to protect and if it's not my patient, I'm going to protect the patient, because they're all our patients, right? Then I'll address the situation calmly. Okay? There's no need to be rude or, disrespectful. We can address everything that happens in a calm manner. And then, if needed, escalate and follow the chain of command and report that if needed.
Stress and adaptability. Nobody likes answering these questions. They're going to be asked.
Yeah.
They're going to be, how do you prioritize? How do you handle stress? How do you manage a patient that is difficult, or a coworker that is difficult, or a patient's family that's difficult?
Yep.
You don't want to say, oh, they drive me nuts.
I know.
I can't do it. I just want to go scream at the bathroom. There's a craft to answering these types of questions. We'll start with, how do you prioritize multiple patients?
You've actually, nursing students have gotten lots of practice with this question through their real experiences in nursing school. What do we learn? Safety first, right? How do we prioritize patients? Airway, breathing, circulation, right? And so, you can state those things, is that I'm going to go with the safety-focused method. I'm going to make sure that I address the things that are most pressing first. Airway, breathing, circulation,
ABCs.
just like we did. ABCs, like we learned in nursing school. And, and there's times I know that doesn't always fit. There are situations that you might find yourself in where ABC just doesn't always help you. Just like on the NCLEX, that doesn't follow that flow all the time. But you can start there. That's a really good place to start, especially as a brand new nurse. They do not expect you to know everything.
Mm-hmm. Okay. They've been there before.
They have. They've been there. And so for each of our personalities, for the retriever, do not overpromise here, because in your quest to help, you want to just say, I can do it. I can figure it out. I can do all of it. Well, you can't. We know that.
You know what they say about overpromising?
No.
You're going to underdeliver.
Oh, my goodness.
Time.
Yeah. Every time.
Every time.
Every time. All right. And so for our bold beginners, we keep going back to that humility piece, is that you are not a one man or one woman, one person show. Is say things like, I will ask for help when needed. I will rely on my teammates, because nursing's a team sport, right?
I will communicate effectively.
Yep, that's right. Right. And for the wallflowers, don't shy away. Use that strong voice, use a confident posture, and ask for the help that you need.
So this is another one when it comes to like prioritizing, is how do you handle a situation when you're feeling overwhelmed, underprepared? Tell me about the time when you have felt overwhelmed.
I think sometimes that when we hear these questions, we expect to say, I've never been overwhelmed. You're thinking on the positive end, right? They're asking you these negative questions, or feel negative, to truly see how you'll respond, because you're a human. they expect that. They know that at some point you're going to be overwhelmed in your role. We all do. We all get overwhelmed in multiple situations. And so they're not asking you this for you to say, oh, I don't get overwhelmed, because we do. They're really just truly trying to see how will you respond in that overwhelm to spin it. So always take the question that they might pose as negative, like you said, and end it in a positive.
Yeah, this is a really easy one, depending on your personality, to go and point fingers.
Yeah.
I was overwhelmed because
Mhm.
blah, blah, blah. This is not a vent session. Remember, these are your future employers. These are your future coworkers. And nobody wants to have somebody on the team that's always doing this
Yeah.
and saying, well, they made my job more difficult. I couldn't do it because they didn't do XYZ.
Right.
This is without talking about accountability or asking about it directly, it is related.
And I don't necessarily think that there's a breakdown for the 3 with this question. I think you just directly address this one no matter what your personality is and share what you did to cope. Like, how did you get through that situation without, like you said, without pointing the fingers? Make it about you. Bring that, me piece back into it, and just share like what I did to make this better. How did I cope through that?
Well, we know coping is a long-term
It is.
skill, and we're always strengthening it and
It's being
bringing
tested.
different aspects, because no matter what your career is, you will feel overwhelmed at some point, if not multiple points, and you've got to fight that from within.
You're dealing with the fragility of human life, like, and everybody's emotions and different personalities and different problems and diagnoses. That can get overwhelming no matter what area of nursing you work in. And they want to know, how do you cope through that?
So that gets us to our final category. This is your professionalism, growth, long-term goals that you have for yourself, or maybe you don't have those, and that's okay too. Just be honest. So the very typical closer question is, well, where do you see yourself in 5 years?
Hopefully still alive and working, right? This is such a hard question, because as a brand new nurse, it's kind of hard to figure out maybe where they see themselves in 5 years, and they haven't landed that first nursing job yet. They don't have a clear, direct path just yet. But it's still important to share something that you do see with this.
I mean, we like asking that question too. We asked it to other nurses that we brought in on previous episodes. How important is it for a recent graduate to have that 5-year plan?
Yeah.
And like you said, say something.
Right.
Maybe you have everything, you're very type A, and you're like, okay, I'm going to do this, and then I'm going to go through this certification, then I'm going to go back to school, and I'm going to achieve XYZ. Right. But we also know life happens at times too. And I think it's okay to be honest here. Maybe just keep it grounded.
Yes, and keep it simple, because one of the mistakes that I believe that students, especially maybe our golden retrievers and maybe even our bold beginners, is that they have plans. They do. They sometimes have very detailed plans, and those detailed plans are taking you out of the role that you are applying for. And so you want to be very careful with divulging too much information here, because they may see that as you are only here for the short term. And so you can share the heart behind the plan without sharing the plan. And so, maybe you want to say things like, in 5 years, I definitely see myself growing as a nurse, learning more and advancing in my nursing career, helping more people, and providing better patient care. What that was saying without saying it is that I want to be a nurse practitioner or a nursing educator. In 5 years, I've already gone back to further my education, and I am already in the next role that I'm in. You didn't say that. Please don't go in and say, I want to be the CNO of your hospital in 5 years. They're like, that's not the role you are applying for right now. So, you can share the heart of the goal without telling all of the information.
Now are you seeing why we say interviewing and preparing is a craft? How do you say it without saying it?
Yeah.
How do I say it by saying it?
Right.
When do I say it? When do I don't say it?
Right.
What are we saying? Who's saying what?
And for the
I'm confused.
I'm like, I'm so sorry. Like, who's doing? Who's on first?
Yeah, who's on first?
Yeah. And I don't want to leave the wallflower out there. Is the wallflower may not have that plan.
Mhm.
The wallflower may be like, hey, I'm just here to learn and grow, and we'll see where we're going. Like, we'll see and there's nothing wrong with that. There are nurses who work the same job in the same facility, on the same unit with the same role for their entire career. And they are helping people left and right and changing lives left and right in that one role. And so you don't have to have, like, Val said, it's not stuck in stone about having a 5-year plan. So, you don't have to have this detailed outline that you're following.
Whatever you want to do or don't want to do, it's a matter of what you're doing now, do it really well.
Yeah.
And that's probably what they're looking for too.
Yeah.
Whatever role I end up in after this interview, I'm going to do it really well.
Right. Be where your feet are.
And we'll see where it takes me.
Yeah.
Maybe prioritization is a strength of yours or a weakness of yours. Maybe it depends on the circumstance, but we know that they're probably going to ask something along the lines of, what is your biggest weakness?
Yeah. And we do not like this question. We don't. That's because certain people just don't like talking about themselves. But when we do, we don't want to talk about ourselves in a negative light.
Oh, yeah. You want to talk about your strengths.
Right. Like, we can shine on those.
But you can't avoid this one.
Right. And I'll tell you, if they ever ask, what is your strength? Like, what do you think some of your strengths are? I will surprise them and go ahead and share what my weaknesses are, even though they didn't ask me. Because they're going to ask it. If you don't share it, they will ask you. So if they ask you this question or if they didn't, tell it. Go ahead and share it. And you need to think about that. Go ahead and prep for this, because we all have one-on-ones that we can share here.
Mm-hmm.
Also, again, leave it on a positive, is maybe you struggle with multitasking. That's not an end all. They're not going to say you can't work here, right? Because that happens. I do sometimes struggle with multitasking, and the way that I've worked to overcome that,
Bringing it back.
Right.
Bring it back around.
Right.
Back around.
And the way that I've worked to overcome that is I practice scenarios where I'm forced to multitask. And I realize what task I do well and what task I need to spend more time working on. If it's something I do well, I spend less time doing that. If it's something that I need to work on, I spend more time learning how to do that well. So that way, when I collectively put that together, I am now effectively multitasking.
Mm-hmm.
And because I know that multitasking is necessary in nursing, because I'm not just going to have one patient.
Yeah. Or even a very common one, too, I think that most people suffer with is, I'll just do it myself.
Oh.
I take on too much.
Yeah.
Which sounds like a positive weakness.
It does.
Because it's like, oh, I'm willing to do it.
Yeah.
Newsflash, that is a very overused, cliche answer.
Yeah.
You can use it as the foundation if
Yeah.
that's where you struggle. How are we bringing it back around?
Right.
I tend to want to do everything on my own.
Yeah.
But I know that I have really strong strengths of XYZ.
Mm-hmm.
But if I'm really being honest and real with myself, my weaknesses are other people's strengths.
Yeah.
And it's important to observe the team and see who can I rely on when it comes to my weaknesses,
Right.
and how can I bring them in to help me out, because my strengths may be their weaknesses, and it may be a really amazing partnership and teamwork accountability that we have built in.
Yep.
But that's also a sign of a good leader.
Yep.
And you're not a good leader if you just say, I'm just going to do it myself. I don't want to teach anybody how to do this. I don't want to be taught how to do it. I'll just figure it out.
Right.
Well, then that leads to mistakes. And then we're going back to answering the questions about mistakes and yada, yada, yada.
Yeah. I think the goal here is, with this question, the goal is not to leave them remembering what you said about your weakness. The goal is to leave them thinking about how you spin it.
Mhm.
And I think that that's wonderful because just like you explained that, you totally turned your weakness into something extremely not only positive but powerful, which is necessary in your job.
Do you have any questions for us?
None that I can think of at the moment. No, thank you. Please don't say that. Like, and we do. And I'll tell you, if you say you don't have any questions, it is not a end. It is not a, you can't work here kind of situation. And if you have asked questions throughout, if you've already asked those questions where they were appropriate, then yes, you are the only person that can say, I don't have any other questions at this time. That is fine. But if you've not asked anything the whole time, if you've just answered the whole time, you should have a question or more than one question at the end of that interview, because I can guarantee you're thinking something that you didn't ask and you were wishing later that you did.
Yeah, and at that point, you kind of missed the opportunity. And this is all about sending those signals, right?
Yeah.
We've said this multiple times, but what signals are you sending? I'm not interested.
Yeah.
I don't really care. This is a waste of my time. I'm ready to get out of here.
I'm just here so I won't get fined. Yeah, like I'm just here to make money,
Yep.
It's a job. I got to do it, So I'm going to flip this. When you go to an interview, you are not the only one on interview. They are too.
Yeah.
They are too. Because most likely, especially with nursing, you have other opportunities. And what you're probably doing is you're weighing those opportunities out. Where not only are they trying to figure out if I'm a good fit, I'm trying to figure out if you're a good fit for me.
Mm-hmm.
Is this a job and a place that I want to work at? So you should have some questions. So maybe do your homework on the front end. Are there any things about, the facility that you would like to know more about? How do they handle XYZ? What is the process for this? What is my role when this happens? And not super obvious questions.
Yeah.
Make them think.
Yeah, make them think.
Yeah.
And there's a lot of information because we know we're doing our homework.
Right.
Maybe they have a philanthropic group.
Yep.
And to me, that would set off like all of these bells and whistles because community engagement is important to me. So I would want to know if I end up working here, how can I get involved in this fund or this program that you have?
Right.
Something will spark your interest.
Yep.
Maybe you want to know, is this a growing department? How has this floor or unit changed in the last 6 months? Where is it headed?
And that is such a positive way to spin the question because you didn't ask it the way you were really thinking it. You spun that question positively because what you were really thinking is, why don't people stick around? Like, what is the turnover? And that seems negative, right? Versus, how does this unit change over time? How does this unit grow over time? Change and growth typically are positive words because even though we don't always like change is a good thing,
Yeah.
And so spinning, this again,
we're doing
finesse.
A dance.
Takes a little time to spin it and learn it and practice it. But that's why you do your homework on the front end. That's why you practice these things on the front end.
Yeah.
Yep. And storytelling, like you mentioned, storytelling before. Like if you had a story and you really wanted to tell it, but you didn't have an opportunity before.
Oh, yeah.
Yeah.
Yeah. So we have those stories in mind that we have prepared out loud. We feel good about it. It's rehearsed, but not robotic.
Right.
If in your interview process, you have not been able to share that story yet because they haven't asked the question that you thought that they were going to ask for that answer, this is your time.
Yep.
You ask them the question that you thought they were going to ask you.
Yep.
Because what does that do? It presents an opportunity for you to share your story without saying, okay, well, there's one more thing that I wanted to tell you.
Right.
And then let me sit here and talk about how great I'm going to be as an addition to this unit or to this team or to this hospital. And then it's a conversation.
Yep.
You can follow it up and boom, check. You told your story. You landed the job. You're getting the offer.
Yep. I think curiosity, especially when it's from a standpoint of it's obvious that you're asking these questions to be better, to learn more, to do well, is a secured the bag moment, because it's like you walk out of there going, I did that. I'm waiting on my phone call now, check. And it's also, from the other side of the room, from the other side of the table, for those people who have those curiosities and tie in to interests that whatever unit or whatever company has, when you're asking those questions of us, it is an automatic on our end too, because we're like interest, respect, trustworthiness, growth, ding, 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 all marking and checking all the boxes.
And this is not breaking news.
No.
Everybody likes talking about themselves.
Yep.
So ask them the question. Let them talk about themselves. Let them talk about their experience. And then you can tie it back to what you wanted to share in the first place.
Yeah.
So if there's anything that you have taken away from today, we hope that it's practice. As funny as it may feel, get in front of the mirror. Record yourself so you can go back and watch it. What body language are you giving off? How is your pace? Practice according to your personality. Or take-home impressions. What do you want them to remember about you? Are you a team player? Are you teachable? Are you safe? Can you remain calm under pressure? Because remember, interviewers aren't looking for perfection. They know you don't have years and years of experience under your belt, but they're looking for those 3 T's: teachability, teamwork, and trust. So challenge for you. Before your next shift, before your next interview, before your next clinical session, start practicing now. Whether you're in school, whether you're actively applying to jobs, whether you're feeling a little bit defeated because you haven't gotten the opportunity that you're looking for yet. Maybe you are in a role right now, but you're looking to grow in your career. Practice, practice, practice. Grab a friend. Ask these questions out loud to yourself. Replay this episode back, pause it, and practice how you would respond, because you'll be surprised at how much more confident you feel.
Okay, and guys, I know we mentioned it a lot, but don't forget to use the STAR method. S is situation or story. T is task. A is action. And R is result.
Bottom line, there's no perfect answer, but there's practice ones. And that's what we want you to feel confident doing. Because the more you rehearse out loud, the more confident and authentic you'll feel when the time counts. Until next time, future nurses,
current nurses,
and retired nurses, thanks for tuning in to the Nursing Navigator by Hearst Review.
Guiding you through from school to the floor, nursing news, careers, and so much more. Learning, growing, passing the test. With Nursing Navigator, you'll be your best. Nursing Navigator's here.